There are now a variety of AI platforms specifically geared toward helping mental health therapists with their documentation. They promise to save you hours of time and lots of frustration. But is it too good to be true? Hi, I'm Dr. Maelisa McCaffrey, founder of the free private practice paperwork crash course. And today I am going to review for you the different types of AI progress note generators, how they work, and whether or not they might actually be useful for your practice. Now, important note here, this is all as of January 2024, and this might be dramatically different if you're even watching this video 6 months from now. So how does an AI platform actually write progress notes for you? Well, there are two common ways that it works. The first way is that you type in some sort of information about what happened in your session, and the AI platform generates the progress note. Now, that could be you logging in and typing in a summary or some bullet points of what happened in the session, all the way to you uploading a full transcript of the session itself. The second way is that the AI platform will actually listen to your session, so you don't need to type anything in, and then it will generate the progress note for you that way. That could be either you uploading a recording of your session or logging into the platform and having the AI listen to your session as both you and your client are speaking to one another in real time. Now, here is where I have to put in my first friendly reminder that even if the platform says it is HIPAA secure, it also depends on how you are using the platform. You must have a BAA with any of these platforms if you are going to be HIPAA compliant yourself. So make sure you have a BAA before you enter any protected health information or PHI. Okay, now back to how this whole AI process works to generate a progress note. Once you have the note generated by AI, you review whatever it's written for you to make sure that it's accurate and you make any tweaks. But then how do you get it from whatever that AI platform is into your EHR or wherever else you keep your client records? Most commonly, you'll copy paste from the AI platform into your client record system. And while some of the AI platforms do allow you to save the progress notes in various formats and you have a BAA with them, and so they are HIPAA secure, they don't allow for things like having a client portal to communicate with clients or allowing clients to sign forms and access informed consents or for you to do treatment plans. So they really cannot take the place of an EHR. They are just a place to generate the progress note itself. There's only one EHR I'm aware of, again, as of January 2024, that actually has an AI system built into the EHR platform. So you can skip this whole copy paste process and going into multiple sections to do the progress note. That system is called Orchid, and yes, we will have a review on that coming up very, very soon. Now remember, I'm going to reiterate that this information is all as of January 2024. So if you're watching this a year from now and there are 10 EHRs that all have built-in AI, don't come at me. Right now, this is the best information we have. So now that we've reviewed how to use an AI progress note generator, let's talk about whether or not these are actually useful for your practice. Most AI platforms claim that they are going to help you with three specific things. Number one, reducing the amount of time you spend on your documentation. Number two, improving the quality of your documentation and specifically for insurance purposes. And number three, avoiding burnout. Now, I already addressed claim number one in the intro to this AI series 2 videos ago. So we'll link to that here, and there will be a link in the description of this video. But essentially, if you have to log into a whole other system and type in information and then copy paste it somewhere else, you're likely doing double work and maybe even more work than you would if you just used a good detailed progress note template. Now, I've tested just about all of these AI platforms that are out there. And I will tell you, one thing that shocked me was how long it took most of them to generate the note. For some of them, especially if I didn't have a transcript, I already had to type in a whole summary of what happened in the session anyway. As of right now, I just don't see how using an AI platform saves you any time unless it's integrated within your electronic health record. And even then, I would argue that you could probably still get a faster note using a very detailed, well created checkbox progress note template. Regardless, as I said in the first video in this series, Test it out for yourself, time yourself, and see what works for you. Let's move on to claim number 2, because this is huge: improving the quality of your progress notes. Because even if AI doesn't save you time, or even if it's the same amount of time, if it improves the quality of your notes, there could still be a strong argument for using it. Many therapists have even said to me, Maelisa, the AI wrote a better progress note than I could write myself. But frankly, I am not so sure. I hate to break it to you, but here is the truth. Having a really clinical sounding note with lots of mental health catchphrases will not save you in an insurance audit. It's much more important to make sure any progress note ties back to the treatment plan goals, your client's symptoms, and your client's diagnosis. That's really what medical necessity is about. An AI may not know that part of medical necessity. You need to show that the client is progressing in therapy, but also continues to need therapy, always linking that to their symptoms, diagnosis, and treatment plan. And that's something that AI may or may not pick up in your session or based on the information you give it and present in the progress note. And even if your AI platform is prompted to create that statement for you in every note, you still need to check it and make sure that it aligns with the current treatment plan and your client's current symptoms. Because we all know it is easy to get off track on a regular basis. And here's a pro tip: no AI can help you avoid an insurance audit, because it's not the content in your progress notes that initially triggers an audit. Insurance doesn't know about the quality of your notes until they audit you for some other reason, which is commonly related to either billing or diagnosing. So, those are the two things you want to worry about nailing down for insurance audit purposes. Now, even if you don't work with insurance, the quality aspect of the notes is still important. So let's dig into that. Just as an example, I asked ChatGPT to write a progress note about a session I gave it, and I said to write the note from a somatic experiencing perspective, even though that modality was not used during the session. So, do you know what it did? It created a whole bunch of information out of thin air, things that never occurred in the session. This includes interventions that the therapist did that specifically was not in the information provided to ChatGPT, as well as client responses and behaviors that were never written down or provided to ChatGPT and did not happen in that session. I know this is kind of an extreme example, but it's a good example of the fact that you have to know what information to give any AI platform, what information is important for the note, what you're putting in, and you also need to have a good understanding of what the final product should look like. You should be able to determine if that progress note is good or poor, but more importantly, why. Lastly, let's talk about burnout. Now, this is a well known fact that documentation is a significant contributor to burnout within all of healthcare. It is not uncommon for me to talk to a therapist at least monthly, if not weekly, who says that they are considering leaving the profession solely because the documentation is so stressful. But this is about a lot more than time management or administrative work. My experience working with hundreds of therapists has shown me that it's actually lack of confidence in what goes in a progress note that is the real contributor to burnout. When you're not confident that you know what goes in a progress note, you'll spend a lot of extra time rewriting information, thinking about what to write, or just plain avoiding the task altogether. Whether or not it takes you 10 minutes to write a note or 30 minutes to write a note, you're questioning yourself the whole time. It really is a huge mental effort. Now, trust me on this, the answer to this problem is not having AI create a bunch of psychobabble for you. The real solution is understanding what actually needs to be in a progress note. So head on over to this video that we will link somewhere here and in the description below that does walk you through exactly what goes in a progress note, and furthermore, how to translate what happens in the session into that progress note content. Once you feel more confident that you know what goes in a progress note, then I would recommend check out these different AI progress note generators. In the rest of this series, I'll be reviewing specific AI platforms available on the market today and showing you the progress note that they each generated for the same session. We'll talk things like pricing, HIPAA compliance, and usability too. So make sure you're subscribed to my channel and hit that little notification bell so that you get a notification every time one of those videos comes out. Until then, happy writing.